Good morning. My name is Keith Lemmer, President of WellNet Healthcare. And first and foremost, thanks so much for being here this morning. We know we had some audio technical issues yesterday, and we appreciate you making the time to rejoin us. For almost 20 years, WellNet has dedicated itself to identifying the root of the healthcare cost problem. And in response to major uncertainties for businesses as a result of healthcare reform, mid-sized and at present, many smaller employers are also considering self-funding their health plans. The total impact of these changes, including large premium increases, as well as countless restrictive and a lot of undefined regulations, leaves all of us, each one of us, with few crystal clear answers about the Affordable Care Act. Because of all of this uncertainty, these same smaller employers are also now resetting the annual health plan contract, in essence considering switching early to a self-funded plan prior to 2014. Self-funded plans will help employers, as you may know, take advantage of a variety of incentives that are exempt by Congress. At the same time, self-funding also allows smaller groups that are traditionally fully insured to avoid many of the costly mandates that the ACA requires. Given these disruptive changes, along with the attention provided within the mainstream news, employers are asking their brokers and consultants to take a closer look at self-funding, not just as an alternative to save, but as a deliberate option, one that reduces risk and manages your clients' healthcare plans. Today I'm joined by one of the brightest minds in healthcare and finance, my associate David Feinberg, formerly of Goldman Sachs. David manages our health plan division. This morning, he'll be reviewing strategies and solutions to help you place your clients in the driver's seat. David?
Thank you, Keith, and thank you all for joining us today. Again, also, let me offer my apologies for the technical difficulties that we experienced yesterday. Really would like to try to cover 5 things today. First and foremost, I'd like to establish what we know about healthcare reform, or at least what we think we know about healthcare reform, do it from a high level, and specifically look at what it means for those businesses that have 200 or fewer employees. From there, I'd like to take some time to highlight the advantages of self-funding, and particularly those advantages relative to fully insured contracts. Third, I'd like to turn the presentation back out onto you folks and review the top strategies that we're hearing from the field in terms of what broker consultants are doing for renewal tactics ahead of 2014. Fourth, we'll take some time to highlight our small group self-funded solution, WellNet Health. With over 3 years in the marketplace, we believe strongly we've got a proven solution, and we know we've been steadily taking market share. And of course, we'll leave time at the end to discuss next steps, particularly for those of you that are ready to begin quoting with us, as well as leave time for questions and answers. Ahead of that Q&A, if anybody does have questions, please feel free to type them into the GoToWebinar control box that should hopefully be on your computer screen. So with that, let's start with the heart of the problem. The number one reason that healthcare reform was enacted in 2010, and we believe the number one pain point for your clients, is inflation. Hopefully this chart, or some version of it, is old news. It's the compounding impact of healthcare inflation rates. They are 2 times overall U.S. inflation, and the net result is that they have resulted in costs that have grown 170% over the last 13 years. And I don't think anybody on this call would disagree that inflation is the problem, or at least it's a symptom of the problem. I'd like to take a moment to look at the government's attempt at a solution. This chart is what we affectionately refer to here at WellNet as the spaghetti chart. Healthcare reform in a picture. Isn't it pretty? Bottom line is we're nearly 6 months out from one of the biggest legislative changes in U.S. history, mandated healthcare coverage. And from where I sit, the experts are nowhere closer to figuring out what this chart means. The truth is, you have to look no further than the cover of yesterday's Wall Street Journal. You can imagine this was a much more powerful slide yesterday when we had the timing, but it highlights that health insurance exchanges are falling behind schedule. And so confusion persists. But all the while, your small business customers continue to face relentless pressure from incumbent fully insured carriers. And in order to best understand that pressure, what I ask you folks to do is suspend belief for a moment and pretend, or actually ask yourself a very simple question. What would Ford do? And at this point, we need to pretend that we're not in the health insurance market, but we're in the steel business. And we are going to advise Ford on the purchase of steel that goes into their cars. But we're going to have to adhere to the rules of fully insured health insurance. So what am I talking about? Well, first, there'd be limited competition. No different than you probably experience in your fully insured markets. Think of it in steel terms. There would be 2, 3, maybe 4 vendors that you could go to purchase steel from. Second of all, you'd have 12-month lead time on inventory orders. It's just a very fancy way of saying that you folks and your clients would have to commit to the rates you're going to pay for steel for up to 12 months, a year in advance. No different than on a fully insured contract, you're guaranteeing or you're agreeing to pay rates for a year. Now, in and of itself, these first 2 bullet points are not necessarily unique within the business world, but any business owner of any size is going to do whatever they can in their power to try to avoid them. Here's where health insurance becomes a little bit crazy. Imagine if Ford had no insight into how much steel they actually consumed. They knew how much they paid, but they had no idea how much steel actually went into their cars. Well, that's no different than your clients today. They know what they've paid for their health insurance. They just have no idea how much they've actually consumed. And to add insult to injury, you folks on the phone, if you were a Ford steel broker, you'd have to tell them that they were lucky to get a 10% price increase because Chrysler and GM down the road just got a 30% price increase, so they should take it and run. So what would Ford do? Back to the original question. Ford would say, forget you, steel company. I'm getting into the steel business. And by the way, and we have these statistics a little bit later in this presentation, those businesses with 5,000 or greater employees, over 90% of them have done that with their health insurance by going self-funded. So what are the small businesses to do, those that are trapped within these 4 bullet points? We like to think of it as simplified self-funding or a level-funded solution. And the best way, if you're not familiar with level funding and self-funding, is to try to compare it to its fully insured counterpart. So on the left-hand side of the screen, you've got a fully insured or a graphical representation of a fully insured premium. It's yellow, it's opaque, and as we can see, it's non-refundable. But it actually does have some advantages. There's a reason it gets sold in the marketplace, and that reason is the ability to budget flat payments. Your clients might not like their carrier, they might not like their plan design, but when you sit down with them, they know exactly how much that they need to pay in order to budget for the upcoming year. What we've created, and several other in the industry, is a level-funded, self-funded solution. But now you can talk in regular business terms, so-called fixed and variable cost. The fixed cost associated with the health plan is that dark blue box that you see up above. They're the fees associated with stop-loss insurance, administrative expenses, even including your broker commission. The light blue box down below is what we refer to as the maximum variable expense, the one down here. It's a little bit of a confusing thought process, so I like to take the analogy a little bit further and compare this to a factory. If the self-funded quote on your right was a factory, well, imagine that the dark blue box, the fixed costs, were the cost to keep the lights on at the factory. The light blue box, or the maximum variable expense, represents all of the variable expense that this factory could consume if they ran 24 hours a day, 7 days a week, 365 days a year. Obviously, if they were closed weekends or demand didn't meet what they expected, that light blue box would be lower. And in health-funded terms, those are savings that are going to accrue directly back to your client. A little bit more on that later on in the presentation. First, let's talk a little bit more extensively about self-funding. The number one advantage, in my opinion, about self-funded versus fully insured is that it offers flexibility. And I recognize this chart is a little bit of an eyesore, so just please don't try to read every line here. This deck, along with additional information for anyone that registered yesterday as well as today, you're going to receive a copy of it. What I would highlight is there are no less than 7 provisions within the Affordable Care Act that apply only to fully insured plans in the health exchanges that do not apply to self-funded. The fees that you see up above, as well as the required plan provisions down below, are going to create a less flexible solution than exists today for your clients, particularly those that are going through the exchange. And not surprisingly, that lack of flexibility is predicted to increase premiums by 3 to 20%. Let's just pause on that for a second. That increase in premiums has nothing to do with an aging population. It has nothing to do with inflation. It results solely on the fact that the plans are less flexible. So now, let's turn the mirror back on you folks. What are the strategies that the broker consultant community has come up with to try to attack what's about to happen in 2014? And from where we sit, we see about 3.5 strategies. The reason there's a half strategy is many brokers are choosing to do their best impression of an ostrich and stick their head in the sand and pretend like this is all going to go away. Well, health reform might be broken. We might not know where it's going, but from where I sit, it is definitely still going to occur. And so you need to be proactive. And the first strategy we see, and actually one that we would applaud here at WellNet, is those brokers that are looking to renew with their current carrier prior to 2014. Now, I think that's half of a good strategy. I think it's really solid for you and your clients to look at renewals prior to the fourth quarter. I can tell you based on our own book of business and based on what we're planning for, the fourth quarter of this year is going to be an incredibly busy time in the health insurance space. And to the extent you can get your clients thinking about their health plan and doing it earlier and making decisions earlier, that is a good thing. However, just blindly renewing with your fully insured carrier is just as good as kicking the can down the road, because a year from now, you're going to be in the exact same position, dealing with the exact same issues, and your client's going to be no better off. The second solution that we've seen gain a little bit of traction in the marketplace are so-called limited benefit plans, or you might think of them as the new mini-med plans. Well, when I hear of these, I think of when Henry Ford told people they could get a car in any color as long as it was black. Those clients or those brokers, we believe, who are offering or pushing these limited benefit plans are giving the illusion of choice or the illusion that they're offering their clients health benefits, when in fact they're offering them scaled-down plans that help no one and oftentimes are unaffordable. And that really flies in the face of the spirit of healthcare reform, and depending on your client, might fly in the face of what they're actually trying to achieve. So, not surprisingly, we feel the best strategy, and the one that we see gaining traction, is self-funding. And this is the statistic that we keep coming back to. As I mentioned earlier, those businesses with 5,000 or greater employees, this is old news. They've been self-funding since the 1970s. Over 93% of that market is self-funded. On the other end of the spectrum, where we focus, those businesses with 200 or fewer employees, it's only 15% penetrated. Now, we're not going to argue here at WellNet that the penetration rate should be as high as 93%, but what we can tell you is that over the next 5 to 10 years, they will certainly be higher than where they stand today. And while this concept is not new, it has certainly picked up in steam in the popular press. In the last 6 months alone, we've seen articles in USA Today, New York Times, the Wall Street Journal, and most recently in CNBC. And for those of you that might not have read these articles or might not be familiar with it, I think that the common theme that I see was actually best stated by a WellNet client who was quoted in the Wall Street Journal. The big guys have a lot more flexibility, and that's what we're trying to get. At the end of the day, your small businesses are stuck in fully insured contracts that are less flexible and facing double-digit inflation, and that's just not going to work for them. So now let's turn our attention more to the WellNet solution in our suite of products. One of the areas, particularly those folks that I'm meeting for the first time, they'll say, listen, I know self-funding. I've got a favorite TPA. I have a self-funded client. I've looked at it in the past. Why do I need WellNet? And what I would argue back to you is that you might not think you need WellNet, but once you see our turnkey solution, and not just what we do in terms of integrating everything, what we do in terms of plan management, ours is a better mousetrap than anything else in the marketplace. Because first, if you were going to try to build this from the ground up, you'd have to go out there and try to establish stop loss. What carriers are you going to work with? Are they going to sell you specific and aggregate protection? Do they have a history of writing in the under 200 market? With WellNet, we work exclusively with carriers that are A- rated or better, those that specialize in the under 200 market, and that we've had a proven track record with. Well, next, you'd have to turn your attention to the administration. Who's going to pay the claims? There are literally hundreds of TPAs nationwide. WellNet works with the TPAs that you see here. These are proven national and regional players who've been around for years. They pay claims, and they do so accurately. And more so than just simple claims administration, what these folks do is they offer us and our clients access to some of the best national networks. Our clients are currently placed with Aetna and Cigna, and to a certain extent as well, regional players that offer them the best discounts. Last but definitely not least, you'd also have to consider the pharmacy side and who and how your claims are going to be repriced. Well, with WellNet, we offer a turnkey self-funded plan where we handle all the underwriting, all the work up front to meet your client's needs. Now, I recognize there are other folks on the market offering turnkey, level-funded, small group solutions. But with WellNet, there are 3 key differentiators. The first revolves around savings. Remember the light blue box, the variable expense? At the end of the year, 100% of the client's money is returned to them. There are other products on the marketplace who try to share in the savings. We do not. The second part is on commission. WellNet's standard commission rate is 6% of estimated maximum cost, or what folks sometimes refer to as a premium equivalent. So when you're thinking of our commission and our 6%, you need to compare it to the 5%, the 4%, the 3%, or even the capitated rates that you might be getting from a fully insured carrier. But the last area of differentiation, and this is where our entire book of business differentiates, and quite frankly, it's the reason I joined WellNet. It's what we do within a self-funded health plan. It's not just a matter of offering an integrated solution. It's taking the data that is inherent within self-funding and using it to create a better plan. We refer to this as population health management. If you're new to WellNet, if you don't know what I'm talking about, I'm going to give you some contact information at the end of the presentation. I strongly encourage that you reach out to a member of our team and schedule some one-on-one time so you can better understand how it is we manage populations. For the purposes of today, though, I'd like to highlight two features of this plan, of this element. The first is our ability to predict future cost. This representation should probably look and feel very similar to most of your clients. You know something about their demographics, the age and sex characteristics, but that's about it. You have no understanding of the underlying health of that population. Well, with WellNet, where we sit, first, we get real-time drug claim data. If someone is getting a drug filled today, it is in our system, what we call WellNet 4.0 overnight. Second of all, we have access to integrated biometric screening. If you're going to go, if your clients are interested, we can have phlebotomists on site or offer them a voucher program so they can actually get the actual biometric data about their employees and perhaps even their members. And again, that seamlessly flows into our 4.0 system. And last but definitely not least, because of our relationship with the TPA partners I highlighted earlier, we have real-time access to all the medical claim data. Well, if you think about it, that's reams and reams and reams of data. What do you do with it? What WellNet has done is we've integrated the Johns Hopkins ACG modeler to allow us to identify so-called medium, high-risk, and emerging low-risk members. These are individuals who we think on a proactive basis, going forward, are at risk of a future high claim. This is not looking in the rearview mirror at who's been a high claimant in the past. We do manage ongoing claims, but it's our ability to predict the future and then not just identify these individuals, but then work with them. WellNet employs close to 24 nurses, each of whom has a minimum of 5 years of clinical experience and is a registered nurse health coach. These individuals engage with the high, medium, and emerging low-risk members. And a really big development for us in 2013 is how we've taken this engagement model to the next level. Specifically, we've introduced the Prochaska Readiness to Change model. All of our nurses have been trained, that's the word I was looking for, on this new model. This new model allows our nurses to not only take their clinical expertise to work with these members in terms of what's going on for them in their health, but then use psychology to try to create lasting change in terms of behavior. The net result is, and it's a little preliminary, if you've seen our statistics in the past, we have about an average 45% engagement rate over the program's history. In the first 6 months of this year, those clients that have embraced this new coaching model are seeing engagement rates north of 80%. The second feature that I'd like to highlight for today regarding population management is our ability to make the health plan relevant to the member. So everything that I'm going to show you here is a tool that your dedicated WellNet account manager would have access to, could work with you alongside the client to develop. But for the purposes of this presentation, I've created a very simple incentive program. So this is a client of ours, has 150 employees, and they're interested in doing a biometric screening. The particular panel that they've chosen costs $75. And before they've rolled that out, they can sit down and look at different incentive programs. Specifically, I've created a stick approach, which is on the left, and a carrot approach, which is on the right. What am I talking about? Well, as you can see here, we've got a slider tool that's going to allow you to model these incentive programs before rolling them out. The stick program is a $40 biweekly payroll reduction. If you don't get your blood taken, your pay gets docked. On the right, it's a $500 annual reward. If you do participate, you get a $500 gift card or cash reimbursement. Based on our experience, we can predict that the stick approach is going to yield a 77% engagement rate. That means of the 150 employees, 115 will participate, as opposed to only a third with the carrot approach. You can see the cost of this program is relatively minimal. It's the 115 participants times the $75. But what's powerful is how we can use that to predict future savings. Because we know what our benchmark is, we are going to take those 115 individuals who have now been screened. It's going to allow us to identify additional high-risk members and then work with them to avoid future expenses. And as you can see, not surprisingly, if you've done any of this work, the stick approach is nearly 2 times as effective as the carrot approach. If I was going to try to put a bow around population management, and I discussed this earlier, it really is a presentation in and of itself. But what it comes down to is it's WellNet's ability to integrate, automate, and connect everything that we do. Specifically for you folks, the brokers, this means integrated analysis of multi-sources of data, medical claims, health risk assessments, biometric screening, RX claims, you name it. As we showed on one of the earlier slides, it includes predictive analytics, and like any good tool, we have on-demand reporting and dashboards. One feature I didn't highlight today is our ability to provide targeted campaigns. We can reach out down to the individual members, or we can split populations. What do I mean by split populations? Think of our ability to target all the males over age 40 who have not had any preventive screenings in the last year, and then identify who those individuals are, message to them to make sure that they get the appropriate screenings. Similarly for the members, what do they experience? They're going to get online and mobile claims access. The portal that we have, what we call WellNet 4.0, is a one-stop benefit portal. And the nice news for you folks is that we have the ability to house data not just on the medical and RX programs, which we're going to run, but dental, vision, maybe any other ancillary product that you might have sold. And like any good tool, we've got real-time, or excuse me, not real-time, we've got relevant health and wellness tools that the clients can use by logging on to the system. The net result of all this comes down to dollars and cents, and this is a client that joined us in 2011. As you can see here, they were spending just over $800 per employee per month for health insurance, and their fully insured carrier at the end of 2010 came back with a 47% increase, and this is pretty much what it looked like. Dark blue box, no visibility, your rates are up 47%. Well, that client approached us, and we were able, in this first year, this box right here, to cap their risk at a 10% increase. The beauty is that through all of our population health management work and everything that we do to manage claims, at the end of the year, their actual experience was down here. So you can see estimated versus actual. The difference between those two numbers was an $80,000 check that we wrote back to the client of their own money. So in addition to the upfront savings we provided them, there was an additional $80,000 on the back end. And now that that client has been with us for 3 years, talk about bending the curve in inflation, we have capped their maximum risk at a 5.9% inflation rate. And their actual results through 2012 are inflation of 3.4%. By the way, if you look at U.S. inflation, we're nearly spot on with inflationary rates in the U.S. So if you're new to WellNet, this is just a sampling of our customers. I won't ask you to read them all, but the takeaway is this. Our clients are nationwide. They're small, they're large, they're private, they're public. We've got for-profit, we've got nonprofit customers. It doesn't matter. What we see as the common thread amongst all the folks that we serve is that they're all looking to get to the root of their healthcare problem. They want to save money, and ultimately they want to proactively help their members healthy, keep their members healthy. We don't expect you folks to do it on your own. We've got a full suite of marketing material. We've got a broker guide that's going to explain the ins and outs of our program. Again, you'll get a copy of that at the end of today's webinar. We've been active in the press in terms of the popular media, as well as we have access to white papers that have been published from the Healthcare Performance Management Institute. We've got the right tools that are going to allow you to teach your clients, retain your existing clients, and ultimately grow your book of business. So to bring this all together, what is WellNet's value proposition? Well, simply, we think we help you folks bridge the healthcare gap for your client. So we like to tell our story, not surprisingly, in pictures. You folks on the phone and your clients are over here. Their employees and their members are over here. And simply put, there's a gap. The employees need coverage from their employers. And for the longest period of time, the large national health carriers, or maybe even regional players, did an okay job of bridging that gap. However, due to inflationary rates and due to a marketplace that has been changing, the gap has widened. The knee-jerk reaction of the marketplace was to bolt on so-called disease management programs, smoking cessation, heart healthy, you name it. That doesn't work. It ends up resulting in a lot of lost money, as you can see, falling into what we call the black hole of healthcare costs. The solution that WellNet has put forward is a true end-to-end solution on a self-funded platform where we handle everything from medical and RX claims paying all the way down to individual member engagement. But again, on a self-funded chassis. So for those of you that are ready to quote us or you have been quoting us, I encourage you to continue to send quotes to quotes@wellnet.com or to call our office at 888-947-9478. If you're interested in simply learning more about WellNet, please feel free to check out our website or call our sales office at 800-808-4014. And before I wrap it up and open for questions, I pose a challenge to you folks on the phone. As I mentioned earlier, we see a lot of you folks looking to early renew your clients. We think that is absolutely the right strategy to begin having these conversations early. But if you're going to be having the conversation about early renewals with your clients, I would all but pressure you to feel that self-funding needs to be part of that conversation. So if you are looking at renewals, please send us those RFPs. Have WellNet be part of that conversation. Because more often than not, and we've seen it time and time again, particularly in the under 200 market, those brokers that are thought of as forward-leaning and forward-thinking with their clients are not only retaining their book of business, but they're writing new brokers of records, because this is a word-of-mouth business. And so for you folks that are out in front of your clients early and talking about these concepts, and more often than not, your clients are going to recommend you to other clients. And so whether you win with WellNet or you win with something else, we have found that it's our suite of solutions that is allowing not only us to gain share, but you folks as well. So with that, let me pause for a moment and take some questions. Okay, here's the first question. It relates to client plan design. It's asking if we have an ability to customize plan designs. The answer is standard protocol for us is those groups that have 100 or fewer employees, we ask them to match, or we put them on a standard WellNet plans. We have our own core suite of plan designs. They look and smell very much what you'll see in the marketplace. For groups with 100 or greater employees, we will match or closely match the in-force benefit designs. We can also, it's worth mentioning, we can administer up to 3 different plan designs per group. Next question, can we choose contract options other than a 1218? I'm presuming this comes from somebody who's either looked at us before, but that is worth highlighting. Our standard quote is going to be written on a 1218 basis. So 6-month run-out is standard on everything that we write, particularly for those that are going from a fully insured basis to a self-funded. Again, the cutoff for us is about 100 employees and greater. Those clients that have 100 employees or greater, we do write 1215 contracts with 3-month run-out. For your clients that might already be self-funded and are looking for a more integrated solution, we can absolutely match in-force paid contracts or more exotic contract types. Third question, are my clients going to receive a big renewal in year 2 due to a contract change? I guess we're in the contract area. The answer is no. If you're written on a 1218 basis, which is it's a fully mature contract, we renew on a 1218 basis. Most of our clients, what they do is if they're looking to reduce the renewal in year 2, it's not about going to a so-called paid contract. It's about perhaps reducing the run-out from 1218 to 1215. That's a good lead into the next question. Are there any run-out fees if the client terminates with WellNet? The answer is no. That's a big differentiator for us. Our pricing, and you'll see it on our sheets, we list it as estimated maximum cost. That's because it is the estimated maximum cost. If your client walks away at the end of the year, there are no additional fees. There are no additional ID cards. There's no additional amendment fees. The fee structure that you see is the same regardless of client size and regardless of anything else. What we have found is that those groups that are trying to sell in the under 200 market, they're not used to all the fees and the pricing schedules associated with self-funding. So we've tried to simplify it as much as we can. Next question, and I'm sorry if I didn't make this clear. It says, does WellNet retain any of the claim surplus? What if a client terminates? This is a huge differentiator for us. 100% of the client's surplus is theirs to retain. We do not share in it. We do not hold on to it. If they move away, it is theirs to keep. We have clients who have saved money in year 1 and have moved away. It's usually for a variety of reasons. They've either gotten bought by other folks or perhaps they've gotten smaller. More often than not, you can imagine the overwhelming majority of our clients that save money with us stay with us. Here's another more experienced question. Can the client fund to the expected level of claims? Can they pay to the incurred, can they pay claims as they are incurred rather than doing the true level funding? For groups, and if you don't know what I'm talking about, please feel free to call us and I can explain this in greater detail, but I'd say for groups with 50 or greater employees, We do permit them to fund to expected. We do not offer a pay-as-you-go model, particularly for those clients that are moving from fully insured to self-funded. We do write clients that are existing self-funded. They might be with a small regional TPA. They might be looking for a more comprehensive solution. For those clients, on a case-by-case basis, we have been doing a pay-as-you-go or incurred model. And let me answer this last question, and then we'll wrap it up. It says, can we adjust the commissions? The answer is yes. Commissions are a completely flexible number in a self-funded contract. Our standard 6% contract is what we are going to quote, 6% commission is what we're going to quote out of the gate. We have broker partners who adjust that up. We have broker partners who adjust that down. We have commission structures that are based on a flat dollar amount, regardless of enrollment. We have commission structures that are based on a PEPM. We can plug in whatever you want. Our 6% commission is our attempt to make the conversion, if you will, from fully insured to self-funded as easy and as seamless as possible. So with that, I see there are some additional questions. I want to be respectful of everyone's time. As I mentioned, as a follow-up to today's presentation, you will receive an email with a copy of today's presentation along with some of the marketing material we discussed. For those of you, as I mentioned, who are ready to begin sending RFPs or have specific underwriting questions, please email us at quotes@wellnet.com or call us at 888-947-9478. If you'd simply like to schedule some one-on-one time with myself or other members of our team to dive deeper, please call our sales office at 800-808-4014. With that, I want to thank everyone for participating today, and particularly those of you who took time yesterday to enroll as well, and look forward to writing some business with you. Thank you very much.